In life, there are some numbers that we keep close to our hearts, such as a phone number or a PIN number. But there are a couple of numbers that directly affect your heart that you should know too: your blood pressure and cholesterol numbers. The chief of cardiology at UCSF Fresno has more.
Hypertension, or high blood pressure, is elevated pressure constantly in the blood vessels of our system. It happens from head to toe, not necessarily on the heart. So it's a very, very serious health issue, and it's often regarded as the silent killer, because most people actually feel okay if their blood pressure's a little elevated. When it gets into the very, very high numbers, people generally complain of blurred vision, headaches, and just an overall not feeling well sensation. But the mild to moderately elevated numbers, most people feel fine.
Dr. Daniele says it's important to get checked out at least once a year if you have a normal blood pressure number, which previously was 140/80, but now has been updated to 120/80.
If you're found to have an elevated number during that visit, then we often will ask you to go home, get a monitor at home, check it several times per week, morning and evening, and track it to see what it looks like at home.
Some of the risks of having high blood pressure are heart attacks, strokes, and kidney failure. And oftentimes, if your blood pressure is up, so is your cholesterol.
So patients have a little bit of high blood pressure and a little bit of overweightness and a little bit of high cholesterol and a little bit of a lot of things adds to one big risk. And so oftentimes when you have high blood pressure and high cholesterol, unless it's genetic related, it is seen in patients, again, are sedentary, elevated body mass index, they're overweight, and as you bring down your weight, both come down together, hand in hand.
But before you kick foods off of your grocery list,
so cholesterol is fat in our system that circulates within our blood vessels. That we have good cholesterol and we have bad cholesterol. Cholesterol is actually very good for us. We need cholesterol in order for our body to function normally. We need a lot of the good cholesterol to make memories and brain synthesis and so forth. We can't function without it.
Dr. Daniele recommends a high-protein, low-sodium diet with some exercise. And don't be afraid to see your doctor.
Doctors are friendly, and you should embrace the opportunity to go to your primary care office and cardiologist. But as a rule of thumb in general, really live life in moderation. That's key. Fad diets are not the solution to all health problems. In moderation. So balanced, healthy diet that is low in processed foods, have a colorful food plate to serve, and exercise. Enjoy life. Walk outdoors and enjoy life.